Welcome everyone to our Mayo Clinic Administrative Fellowship Program webinar. We're thrilled that you're interested in our fellowship program here. And today, my other co-fellows, Brenton, Raven, and I will talk through and provide you all with a history and overview of Mayo Clinic. And we'll talk a lot about our fellowship program here and what to expect with the upcoming application cycle. We'll start first with some introductions. My name is Courtney Horace. I'm a first-year administrative fellow out of Rochester, Minnesota. I'm currently in my Department of Lab Medicine and Pathology rotation here, and I got my Master of Public Administration and Policy from the University of Colorado, Denver. It's nice to be here with everybody today. I will pass it over to Raven to introduce herself.
Hello, my name is Raven Brewington. I'm a second-year administrative fellow based in Arizona. My current rotation is split between advanced care at home and clinical systems oversight. And I went to graduate school at Hofstra University to get my Master's of Public Health and my Master's of Health Administration. Brenton, pass it to you.
Hi, everyone. Glad you're joining. My name is Brenton Hill. I'm a second-year fellow located in Rochester and currently rotating through our cardiovascular disease group, and did my law degree and master's in healthcare administration from the University of Kentucky. Hope you enjoy the presentation.
Thank you both. A quick overview on the agenda today. We will be talking a lot about Mayo Clinic. We want you all to know some of the history of Mayo Clinic, and we'll also spend a large portion of today's webinar talking about our fellowship program in detail, talking about what it looks like to be a fellow, and Raven, Brenton, and I will actually share our personal experiences, including some of our rotation experiences at our various sites. At the end, we'll share all of the details you need to know before applying to our fellowship program, and we'll provide some contacts that you can reach out to if you have any questions following the webinar. Mayo Clinic is a nonprofit academic medical center. Our headquarters is here in Rochester, Minnesota, and then we have two of our destination medical centers, one in Florida and one in Arizona. We also have quite a large community presence with our Mayo Clinic health system, which comprises 4 different regions spread out across Wisconsin, Minnesota, and Iowa. At Mayo Clinic, our practice specializes in treating serious and complex diseases and some of the most complex cases around the world. Each year, we have millions of patients who travel to Mayo Clinic to really receive that specialized diagnosis, the specialized care they need, and often it's their last resort. A lot of our patients that come here to Mayo Clinic, they've already been to several hospitals, several doctors within their state, and they really are looking for that expert opinion, which is why they come here to Mayo Clinic. A bit about our logo, which is quite interesting to many people. In the top left-hand corner, you'll see the Mayo Clinic with our emblem, the 3 shields there. And these 3 shields actually represent our clinical practice, research, and education. All of these shields work together in an integrated fashion and really allow us to provide that best possible care to our patients. Our mission is to inspire hope and contribute to the health and well-being by providing the best care to every patient, again, through clinical practice, education, and research. Our primary value here at Mayo Clinic is the needs of the patient come first. This really is a value that all staff members embody and embrace. It's plastered on all of our buildings, and we discuss it in all of our meetings as well. I've been in a lot of meetings since I started the fellowship program where you'll hear someone ask the question, what's the impact to the patient? Or how does this impact the patient at the end? And really everybody cares a lot about how a patient will be impacted by the decisions we make, which is really important. And if you ask any staff member here what our primary value is, they would all say that the needs of the patient come first. And I think that is what attracted me to Mayo Clinic, and it's really something we live by here. We also have a unique model of care, quite different from some other academic medical centers in that we have salaried physicians, which encourages unhurried exams. And we also really emphasize a team-based approach. A lot of our patient care teams are comprised of multidisciplinary groups. We often will have physicians, nurses, administrative partners there, all weighing in to ensure that we provide our patients with the best care, and we're providing them with that expert opinion and the diagnosis that they come to us expecting. And we're very prideful about being ranked #1 hospital, and there's a lot of work that goes into that every single day in our interactions with our patients. And we also really strive to be #1, regardless of what the rankings show. Every day we're striving to be better than we were yesterday. Mayo Clinic has a very long history, and it actually started in 1883 with a tornado that swept through Rochester, Minnesota. And coincidentally, at the time, Dr. William Worrell Mayo was here examining new recruits for the Union Army and happened to be here when the tornado struck and rendered care to a lot of the injured locals, along with Mother Alfred Moes, who was also here, providing care, especially the spiritual care, and really pouring faith into the community. Now, Dr. William Mayo at the time and Mother Moes got together and envisioned how they could continue the support of the community. And in 1889, St. Mary's opened initially with 27 beds. Of course, it's expanded since then, but they really had this vision to provide care not only to the community members in Rochester, but beyond. In 1919, the Mayo brothers officially signed the deed, creating what's formerly called Mayo Clinic. And during that time, they continued to practice their medicine, surgical, and operational competencies. They've made a lot of discoveries within that time since they started St. Mary's Hospital until their death in 1939. And here at Mayo Clinic today, there's actually their original offices are preserved in one of our buildings. So for those who are interested in history, it's a really neat thing to see here at Mayo Clinic, along with a case that has all of their surgical instruments as well. Since their death in 1939, Mayo Clinic continued to expand based off, again, on that vision of Mother Moes and Dr. Mayo. And in 1984, we announced the expansion in our Florida campus. You'll see the rendering of our Florida campus there in the top. And then in 1985, we announced the expansion of Arizona. And there's a picture there of our founding staff in Arizona in 1987. And in 1992, we established our Mayo Clinic Health System, again, that is all around Minnesota, Wisconsin, and our Iowa regions, providing that care to our rural communities. In the past decade, we've also been trying to expand our scope and our influence around the world. And this has included a lot of partnerships with our international organizations and also establishing ourselves in key areas internationally. The first is Mayo Clinic Healthcare in London in 2018, and then Sheikh Shekbout Medical City in 2019 as well. And that's also the largest healthcare system in Abu Dhabi, really dominating that region and providing care for hundreds of thousands of individuals in the Middle Eastern areas. At Mayo Clinic, in addition to the needs of the patient come first, we also have several other values that we hold very dearly here, and they spell out rich ties. These are values that comprise the DNA of our institution, and symbolically, this image also presents a helix shape, which is like DNA. And it really does weave through our daily interactions that we have with one another. And these all started again with the Sisters of St. Francis and Mother Moes and Dr. Mayo, really thinking about how can we continue to provide care for our patients. And something very important is that healing, compassion, that teamwork and camaraderie that we all aspire to use in our daily interactions with our patients as well. And right now is a really exciting time to join Mayo Clinic. We've been focused a lot on not only providing care to our patients today, but also thinking about the future of patient care. And it involves a lot of innovation, a lot of new technology, and leveraging our new technology to think big and really dream and really think about how we can make sure that we're delivering care to our patients in the future in different ways. We've had a lot of expansion of telehealth services like telestroke, tele-ED, tele-OB, and so on. And we've also been providing expert care to patients all across the country through our advanced care at home and incorporating different models of care to treat and reach more patients outside of the typical hospital setting. We've also had a lot of expansion at all of our sites, all of our destination medical centers, as well as our health systems. And so it's an exciting time to join Mayo Clinic. There's a lot of innovation happening, not just in our research sectors, but also within our clinical practice as well. And it's been exciting to be a part of it as a fellow for sure. I will pass it over to Raven and she'll talk a little bit more in depth about our fellowship program.
Thank you so much, Courtney. As you all might know, the program is approaching 40 years being in existence at Mayo Clinic. We've had a number of successful leaders go throughout our program, and we've had 100% retention rate for the last 6 years. So we've had well upwards of 175 fellows, I'd say. So we've had a long-standing existence here at Mayo Clinic. Here is an example of some of our awesome second-year fellows and where they've been placed. As you can see, it ranges from the practice and education, even strategy. So folks, whether you started in one practice or wanted to end up in another place, you might rotate whatever site you work at. So they're all going to bigger and better places since they've placed jobs after the fellowship. These are also some of our fellows that are still at Mayo Clinic and running things at the respective spots. So we have AJ, who used to be a fellow in 2002. He's now a chief administrative officer in Florida. Similarly, we have Roshi, who's the CAO in Arizona, Chris Hasse, CAO in the health system. Our current program director is Tanita Waters. So we have a wide range of folks, again, depending on what shield you want to be in. Even Brianne, she's in human resources, but has been in the practice as well. And a little bit more about the program itself. It's a 2-year administrative rotation-based program. So you're in your rotations about 2 to 3 months. You're selected one of the 5 sites when you get chosen for the program. You'll range in about, I would say, 8 rotations almost within that 2-year time period. You're going to have a lot of opportunities, whether it's joining committees, being a part of stretch projects outside of your rotations, joining different Mayo Clinic employee resource groups. So that could be anything that you affiliate yourself with. We have an India merge, we have a disability merge, we have a veterans merge. So you'll find that close-knit community, whether it's something you identify with or you want to support. They do a lot of community service and great initiatives across the different campuses. And there'll always be tons of professional development opportunities as well. So with this fast track transition to get graduate students into leadership positions, this opportunity exposes you to so many different areas across our shields and institution. And of course, we have a lot of benefits. So competitive salary, relocation assistance, depending on where you're moving from, included in that benefits package. There is professional development funding. So that could be assistance to go to a conference, take a course, some kind of certification. You'll have access to Mayo Clinic's School of Professional Development, which is one of our 5 schools. You can take different courses, go to seminars and conferences as well with that. You'll have an opportunity to pursue academic rank here at Mayo Clinic. Education is a big part of what we do. So we see based on your experience, your criteria, you might be interested in teaching, you might be interested in research, and we continue to help you build that portfolio throughout your program to pursue academic rank as well. So a lot of us might be instructor level or assistant professor, but you can always work towards that as you develop throughout your career. And leadership exposure is there as well. So we'll be at different committee meetings. They'll ask you for your input or whatnot, and regardless of what campus you're at. So as you can see here on the map, I'm in Phoenix, Courtney and Brenton's in Rochester. We have fellows that are in Florida as well, and then the health system. So we have close to 3,000 hospital beds, over 150 operating rooms, and I think it's closer to 70,000 employees now at this rate. So it's definitely a great time to join Mayo Clinic and the extreme growth that's happening across our enterprise. And with our rotations, you have the opportunity to customize your experience. So while we might have the core areas of education, research, the practice, finance, human resources, and strategy, there's plenty of fellows that have other areas of interest as well. So as you meet with our program director, your site director, and even the mentors that end up getting assigned to you, we'll talk a little bit about that later. You'll have an opportunity to really say, hey, I've never seen this space and I want to work in this space, whether that's IT or policy work. It could be something with managed care, and it could just be a stretch project outside of your normal rotation as well. But you're really going to have the opportunity to tailor that experience to match your interests, and really process of elimination. Where do you see yourself going in your healthcare career as well? So these are some of the elective rotations I kind of touched upon. So we have marketing, international, platform, patient experience. There's so many opportunities and lanes within healthcare that you can really expose yourself through in these 2 years. And everyone has an opportunity to have an interim operations manager rotation as well. So you could be in the practice and do project work, or you could be in the practice and serve as that manager, that first, sign of leadership if there's not supervisors in the department, what have you, and be there for the frontline leaders, work with the physician leaders, work with our advanced providers. And it's an awesome opportunity. It could be anywhere from 3 months to 6 months. It'll range, but it gives you a good taste of what the practice feels like and leading initiatives in that space. So outside of that, I did mention some stretch projects or even opportunities to shadow. So you can contribute both within your rotation and outside of that. You'll have stretch assignments. I know I've had the opportunity to do several stretch assignments regardless of what rotation I was in. And you'll really be able to be that first voice at the table, that new person, that refreshing look, to show leaders what you have to contribute to all the different projects and innovative ideas that they have here at Mayo Clinic. In terms of our professional growth, beyond conferences and courses and things that are going to be available to you, you'll have a great support network of mentors, formal and informal, of course. So you'll get an executive sponsor. That'll typically be like the associate administrators within our hospital. You'll have an alumni mentor. That could be any position, but someone that has been through the program itself and is still working at Mayo Clinic. You'll have your program director, which we mentioned, and a site director for every respective site. You'll have a second-year fellow. So I have a first-year mentee, which is great, being able to lead them throughout the program, answer any questions, just be a sounding board for them as well. And then you'll have an HR leadership development administrator as well. And they'll talk to you about your development plan prior to starting the program. They'll talk you through some growth areas throughout the program as well. You'll also get to do an evaluation throughout the fellowship to say, how have I learned and grown, and where are my other areas of opportunity as I go throughout the program, finishing it up. So a look inside of the fellowship, I'll kick it off with my experience. Here are all my rotations from education to marketing. I did some IT, and then I was in the practice, of course. So it might not look like everybody else's path, but again, we all had that opportunity to tailor our own experiences. My favorite was really a project that I got to do. So I got to sit with our associate administrator levels, are the highest of the high at Mayo Clinic, making sure here in Arizona, how do we prioritize the growth here? So our operations administrators and our operations managers, as well as with the clinical leadership of departments, would come to this meeting for our OCG and say, hey, this is where our practice is growing in the field. This is how many more staff we might need to support the practice growth as well. So it was very interesting to see how Mayo kind of strategically planned for their growth, whether that was physically within the building or by that FTE. And why Mayo Clinic? It was obvious for me, I wanted to expand my skills and leadership development. I'm from New York, so I wanted to get a new payer mix, new patient population, see what was different in the Southwest, and Mayo Clinic model of care, category of 1. So I definitely wanted an opportunity to see something new and be a part of that magic. And on the right, you can see some of my experiences in life in Arizona. Like we said, you can shadow. So I got to shadow in our simulation center. where the residents were learning how to implant cochlear implants. I volunteered with the Ronald McDonald House. I'm involved with ACHE and NACI. We've gone to games, done walks, and I've even gotten to visit the Rochester campus in Florida, even though it's not pictured. So it's been a great time to be able to connect with fellows and alumni and stay involved. I'll pass it off back to Courtney.
Thanks, Raven. In addition to Raven, my journey has been very interesting, and it's involved a couple different areas around Mayo Clinic. As a first year, I've been through a couple of our core rotations. I started first in research, which was a great experience being exposed to all of the innovation that's happening with our physician scientists and our scientists at Mayo. I also spent a lot of time in our quality department working on our patient experience. I got exposure to international quality and global consulting. And then right now I'm in our Department of Lab Medicine and Pathology, which covers all of our labs at Mayo Clinic. And I'll be transitioning into finance in a week now. One of my favorite, or two of my favorite projects, because it's really hard to pick. My first has been the PFAC toolkit, which comprised me working with and collaborating with departments all around Mayo Clinic to find what was the best way that they've been able to solicit patient feedback. Of course, hearing from patients and family members who have been to Mayo Clinic and who have received care here allows us to continue to better our experience for them. And so I worked with a couple other team members to put together a toolkit to really guide departments in creating a PFAC from scratch. And we've had a lot of success so far. We've had over 12 departments around Mayo Clinic reach out to us because they're interested in creating a PFAC. And we have several at Mayo Clinic right now, and they've been great resources. And they've had a lot of really successful projects, improvement projects come out of those patient family advisory councils as well. My second favorite project has been my transfusion medicine project, which has included me doing a lot of analysis and collaboration with our blood donor center. We have one of the largest blood donor centers in the country, and we're very different than a lot of other academic medical centers in that we have about 70% of our blood is used in all of our surgeries and transfusions are from our donors. So our donors are a critical component to our operations in the clinical practice. And this project, I've been working with the supervisors in the blood donor center and transfusion medicine to see how we can optimize the use of our blood that our donors are giving. And it's been a great experience. And I've learned a lot that I probably wouldn't have learned if I wouldn't have reached out to the blood donor center and really asked them if there was any work that they needed or any process improvement or efficiency improvement projects that they had, which I think is a unique part of the fellowship, is that you start to network and meet different people. And if you remain curious and start asking them questions, you never know what types of projects you might be able to take on. Why Mayo? Initially I was drawn because of the values of the institution and also the opportunity to leave an impact at such an incredible organization really spoke to me and it excited me. And it still does today. It's really awesome to be able to contribute to bettering patient care. It's awesome to be able to work with so many intelligent and bright and devoted people on a daily basis. And I put there the people at the bottom. I've met some of the most amazing people here in Rochester and also in my meetings from other parts of the country as well. And everyone really cares about making sure that patients receive the best care. And again, that primary value of the needs of the patient come first. It's awesome to see it play out in our daily interactions. On the right, you'll see some of my fellowship experiences. I've been to several conferences here, got to present my research in Arizona at one of the conferences, and that was a great experience for me. So if you're interested in presenting research or submitting abstracts, that's definitely something you can do in your fellowship program. I've also had the opportunity, because of my background in government affairs and my interest in policy, I've been able to shadow our government affairs team at the state capitol, which was awesome, seeing some of the important bills and testimonials from people on important healthcare policies in Minnesota. A couple of the other pictures there, some of my other fellows and I getting to tour our Mayo 1, our private airplane there and our ambulance centers. Veterans Day 2022, Raven spoke a little bit about our merges, and I'm a part of the Veterans Merge, and we got to plan our Veterans Day here in Rochester last year, and excited about this one upcoming. And then the bottom two pictures have been my life in Rochester. I coach volleyball in town, which takes a lot of my time outside of work, and I've been enjoying that. And then the bottom right is the county fair, where me and a couple other co-fellows here attended one of the fairs, and we've been able to get out and experience Rochester and Minneapolis a lot. So it's been a lot of fun. I will pass it to Brenton next.
Thanks, Courtney. What I wanted to do with my fellowship experience is really present what a non-typical fellowship experience can be for candidates with different backgrounds like myself. So, first you'll notice by some of the pictures, I'm married, have a family, and so quite different from the typical administrative fellow. All that's possible in our fellowship, was very accommodating when I had our daughter, had it at Mayo Clinic, had that unique experience, so that was great. But also, I have my law degree, which a lot of administrative fellows just don't have. What I think is unique is, you're going to see my rotations. I've been in hospital operations, revenue cycle, research. I've been in our Center for Digital Health working on regulatory things, risk management, compliance, Mayo Clinic platform, and then an interim OM experience in addition to my cardiology rotation that I'm doing right now. What the fellowship allowed me to do was take a legal regulatory bent on all those and really explore my interests, passions, and really diversify my skill set. So I think that's a great opportunity that we have here at Mayo, is people are willing to utilize your unique skill sets and all that you bring to the table in a way that's most effective for you and for the different areas in which you're going to support and serve. So I think it's a great consideration for someone who says, how do I fit into Mayo Clinic? How do I fit into administrative fellowship? We do offer that and that ability to do so. So definitely a big consideration for folks like me who may be a little bit non-traditional. And one of my favorite projects that I was able to do was authoring Mayo Clinic platform's regulatory playbook. And that really married my legal analysis skills and then my operational skills that I've learned here in the fellowship to say, what are the legal implications for some of the things that we're trying to do with our Mayo Clinic platform, and how can that, what are the implications from an operational perspective? And I've been able to lead teams, have been able to guide, certain individuals to be able to do that. And it's been a great project and a great showing of what an administrative fellow is capable of bringing to the table. So for me, that was definitely my favorite. I think why Mayo AFP, first, I think it's really important that people know that you're able to experience the forefront of healthcare innovation, not only clinically, but the things we're doing outside the walls of the hospital. Our CEO is very focused on transforming healthcare, not only from a physical space in terms of, the procedures that we're performing, the physicians that we're hiring, but also, looking at how we're transforming healthcare from a digital perspective. And so you're going to get to be a part of that and be able to see that, which I think is super unique from a health system perspective. And on those same lines, you're going to be able to experience the full depth and breadth of health system potential. Typically, we think of health systems as brick and mortar institutions that, serve patients either in the inpatient setting or on the outpatient setting, doing procedures, getting visits and what have you. Mayo Clinic takes a different approach. We have research, we have education, we have all these other initiatives that we're marrying with our inpatient and outpatient capabilities to really deliver an experience for patients that's unmatched and that's super unique. So that's another reason why I chose Mayo Clinic AFP and why you should too, quite frankly. And then I think, last 2 points here, 2 years experience in an academic medical center setting with opportunities expand on various skill sets is super important. I think sometimes people look at a 2-year fellowship and say, is that a waste of my time? Can I just go and get a job already? I think there's 2 different ways to look at it, but from our perspective in our Mayo Clinic fellowship experience, 2 years is 100% worth it. It gives you enough exposure to various things around the enterprise that you're really able to hone in on your skill set and really choose a path that's unique to yourself, that no one's going to force upon you. So I think that's super important. And then the last, I love Rochester winters, and that's of course joking. Rochester winters are hard, but it's very unique to be in Minnesota. But yeah, definitely love Rochester. And off to the side there, you're going to see some of the different photos that I've had. Like Courtney, I was able to go to the Capitol, shadow our government affairs group, and see the wonderful advocacy they do on behalf of our health system, and then our clinicians as well. Of course, had a baby with my family. We get together as fellows. We consider ourselves a family, and so we get together with our families and bond like that. Was able to do a couple unique tours, hazardous waste, where we were able to see various wastes that occur at Mayo and how they're disposed of. And then our waste management tour, we have a big facility here in Rochester, which was really unique. And then I'm a big fisherman, and so Minnesota offers you really unique instances of fishing up near Canada. So a lot to do here in Rochester, even if it is a smaller town, and really good experience. So I wanted to get to the timeline, important dates. One of the most important parts about this webinar. So application begins in June. We really, although there is a deadline, we really highly advise that you submit your application beforehand, just to make sure there's nothing you need to address or any questions we might have. So a tip there, apply by early September 2023, and then you would begin in July of 2024. We like to say the easiest way to be eliminated is not to turn in an application, or not to be able to due to technical errors. So don't let that be you. We want to consider everyone, and don't let yourself be eliminated just because of a simple error on your part. Last, I wanted to go over a little bit of application details. So qualifications, we're not looking for anyone in particular. We're willing to consider a wide range of applicants, and that really shows here, but we really need you to have completed a master's degree, or at least the didactic portion of that master's degree before the start of the fellowship. And we consider, M.H.As, M.B.A, M.P.Hs, M.P.As, even JDs, not excluded, or really any other master's level degree that has a healthcare bent to it. We're willing to consider. Please apply. That master's degree has to be CAMI accredited, but non-CAMI programs are also considered. And then, you need to have somewhat of a healthcare industry experience. Obviously, we don't want you coming to Mayo Clinic, coming from a different industry. It needs to be somewhat healthcare related. But, again, apply and we can make that determination. Then, you need to have broad knowledge and of current and historical perspectives on assortments of topics that are on that web application page. On the right-hand side there, you're going to see, candidate application form, resume. You need graduate letters of recommendation, unofficial undergraduate and graduate transcripts with awarded or conferred degree. And for more information on that, please contact Jennifer Ebel with any questions, or even we have a QR code that you can scan there for more information. Courtney, I'll turn it on back to you.
I will stop sharing my screen. We appreciate everyone who's watching this recorded webinar, and we hope that you'll consider our fellowship program. I think all of us spoke to the fact that we've enjoyed our experience. We've learned a lot, not only about Mayo Clinic, but about healthcare in general around the country and around the world. And if you have any questions, please do follow us on LinkedIn. We have a LinkedIn page, Mayo Clinic Administrative Fellowship Program, and you can find each of us on there and message us individually if you have questions as well. Thank you.
Thanks so much.
Yeah, have a good day.